The U.S. Surgeon General's advisory means youth mental health is a significant public health challenge that needs immediate attention. The advisory says more than 140,000 children in the U.S. lost a parent or grandparent caregiver due to COVID, and ER visits for suicide attempts were up 51% for adolescent girls as compared to 2019.
I've noticed, particularly with teenagers, there really is a mental health crisis.
Dan Rothenberg is a licensed therapist who works with teens and young adults. He says this school year has been tough for kids.
And so now we're all catching up. And so with that has come a lot of anxiety, a lot of depression.
Teachers and school psychologists have reported the same thing, showing up through classroom disruptions to full-on fights on campus.
I'm Dr. Sarah Polly. I am the medical director of the Youth Continuum for Hazelden Betty Ford Foundation.
Dr. Polly is a child and adolescent psychiatrist.
This is something that has started for young people even prior to the pandemic. And I think there's a lot of different factors that have influenced why young people are struggling more.
Some say the increased depression and anxiety might be linked to societal factors, climate change, racism, or even anxiety related to social media. The pandemic adds more stress.
Our infrastructure of the mental health business has not kept up with the need of the increasing anxiety.
Dr. Polly agrees, and school psychologists have said they are understaffed, making it difficult to meet students' needs.
The National Association of School Psychologists has a recommendation of one school psychologist per 500 students. And in Oregon, most school districts are double or triple or even more of that recommendation. In Salem-Keizer, we're hovering about 1 to 3,500 students for our ratio.
There's a huge shortage of people who are qualified to work with children and adolescents and families that are struggling with mental illness.
Both Polly and Rothenberg agree the Surgeon General's advisory is a call to action for more resources and funding specifically to address youth mental health. Christine Pitawanich, KGW News.